Hey y'all, welcome back. I promised you a really exciting video on the menstrual cycle, so here we go. This is my rendering of the menstrual cycle, but before we get to that, let's talk a little bit about the hormones of the female reproduction. Most people think about estrogen, and that's obviously one of the primary female reproductive hormones, but there are a couple others that I want to talk about before we get started. It'll help you understand the cycle as a whole, okay? So estrogen starts mostly at puberty. It's important for the maturation of the secondary sex characteristics, which are things like growing of the breasts, axillary and pubic hair. It matures the uterus in size and function. It matures the vagina. It gets thicker, more pliable, more moisture, and it gets hospitable for the that lactobacilli that we talked about in the last lecture. Really important for the self-cleaning mechanism of the vagina. It's the estrogen that makes that environment hospitable. It's also important for muscle and bone strength, and it is important throughout the life cycle. Through the life, it helps the skin with maintaining its pliability. It has great cardiovascular benefits, decreases inflammation in the heart, improves blood flow, and it improves the cholesterol ratios. And it's one of the main reasons that people think that women live longer than men, especially before the age of 50. They have this great benefit from the estrogen on the cardiovascular system. As opposed to testosterone in the male, which gradually drops over the life. We talked about 1% decrease in testosterone per year. At the menopause, the estrogen levels start to get erratic. They don't just drop off, but they might be high one month, they might be lower one month. And we're going to talk about a little bit about ovulation and why that should make a little more sense why that happens. The next hormone that I want to talk about is progesterone. Progesterone's main job is to support the endometrium for a conception and implantation. But it's also the hormone that gives you premenstrual syndrome, PMS, and about 50% of menstruating females will experience at least one component of PMS. And the question is out there, if you look at the internet, is it a friend or is it a foe? There are people who suggest that progesterone is a great hormone, be all end all, and makes you feel great. Well, I don't know a lot of people who really feel good at the progesterone part of their menstrual cycle in the PMS time. We'll talk more about that. If you really would like to dive into that, there's a great article called Progesterone, Friend or Foe, and I suggest you take a look at that. Testosterone. Testosterone is present in the female reproductive system. And an imbalance in testosterone, if you have too much, you might have acne, excess facial hair in like a male pattern. You can have irregular menstruation, and you can even have an enlarged clitoris, which if you spread the labia and you see a clitoris about the size of my thumb at the end, that's larger than it should be, and you would want to go see somebody and check the testosterone level. It can also be a little bit low, and that tends to go with a decreased libido. Prostaglandins are not specifically hormones, but they act like hormones. They are found throughout the body. They are really important for menstruation because they help the uterus contract and shed that lining. But they also cause a lot of the symptoms during the period, and we're going to talk a little bit about that. Okay, so let's go on to our menstrual cycle. I'm going to get rid of my chair. And this looks like a lot of lines, right? There's hormones going up, hormones coming down. But what I'd like to do is not fall over my cord, is to explain it in a way where you don't really need to know like which line goes up, which line goes down, but the general premise of where the hormones are most prominent and how that affects the menstruation, but also the rest of the body. Okay, so there are two cycles, two parts of the cycle. One is called the follicular phase, one is called the luteal phase. This is ovulation here in the middle, but even though our ovulation is here in the middle and we have a 28-day cycle, this part of the follicular phase can be anywhere from 14 to 21 days and still be normal. So if you have a menses that comes every 35 days and you say, I'm irregular, you're actually not. You're totally normal. Okay? What does that mean, 35 days? People get very confused where to start counting. Day one is day one of the period. And it doesn't matter if you had a whole full flow or just a drop of blood. When you start seeing blood, that is day one. Okay? So that's day one. Ovulation, we generally say occurs at day 14, but like we now know, this can be anywhere from 14 to 21 days and still be normal. Okay. The second half of the cycle, though, is called the luteal phase, and that'll make more sense when we talk about the corpus luteum and the progesterone and how that happens. The luteal phase, that's always 14 days. Okay, so from the time you ovulate until the time of the next period, which would start right the next day, it's always 14 days. So people will count out when they're fertile, trying to either achieve or avoid pregnancy. But the only way to do that is in hindsight. So you might think that every 28 days you're getting a cycle, I can just pick day 14. But what if your follicular phase that month is lengthened? So stress, you've got big exams. That can delay ovulation. So you're not necessarily sure to be in this phase after ovulation when you won't get pregnant. Okay. Same thing with if you're trying to get pregnant, it's much easier to know when you're going to ovulate than the fact that you ovulated. And we now actually have ovulation predictor kits, which look at one of the main hormones that cause ovulation, so you can predict when you need to have intercourse to get pregnant. It's all super cool. So in the follicular phase, why is it called the follicular phase and what is going on? Okay. You can see that during the period, which is this first phase, most of the hormones are low. Your progesterone is low, your follicle stimulating hormone, your luteal hormone is low, your estrogen is low. Your follicle stimulating hormone is already a little bit high, okay? That's during the menstrual cycle. But that is the time when you have the prostaglandins. Those prostaglandins are causing uterine contractions, they're causing menstrual flow. They also do things like cause headaches. They can cause increased reflux in the stomach. They can cause diarrhea. All these different symptoms that you may experience during your period are caused by the prostaglandins in this first part of the cycle. Wouldn't it be nice if there was an anti-prostaglandin that could just decrease that? Well, lo and behold, there is. There is Motrin, ibuprofen, a pretty common drug that we use for, a little headache or something like that, That's actually an antiprostaglandin. And if you know when you're going to have these symptoms, you can take a day or two ahead some Motrin for that entire day or two, and it will actually decrease these symptoms. The other thing that prostaglandins do, obviously, since we talked about, is contracting the uterus and causing the endometrium to shed. If you have too much, you can have a very heavy period and you can have a lot of pain. So if you likewise took some antiprostaglandin, that ibuprofen, a day or two ahead, you can actually decrease the heaviness and the pain, the painfulness of your period by using an antiprostaglandin. Okay, so that's the first part, that's the period. Let's go on to the follicular phase. We notice that the FSH is a little bit high, follicle stimulating hormone. We talked about that a little bit in the last lecture. Let's go to our ovary. In this follicular phase, we are, that's a cruddy one, we are stimulating, we said 8 to 20 little follicles in the ovary. And we said follicles are sac-like structures that have something growing in them, essentially. Early in the follicular phase, you can see the estrogen starting to rise. Okay? That is because these follicles start secreting estrogen. They're looking for one dominant follicle with the egg or ovum to mature. Okay? When the estrogen gets high enough, that egg is mature, you remember the hypothalamus and the anterior pituitary, you have a feedback loop that says, let's put out some luteinizing hormone to signal ovulation. Boom. Out comes the egg. Okay. We talked about these are the little fimbria that are grabbing that egg to take it through the rest of the reproductive system. This follicle now becomes the corpus luteum. Okay, so we'll put this up, but corpus luteum. Okay, that's where we get the word luteal phase. Okay, that is responsible for putting out both a little bit of estrogen, but mostly progesterone. And we said progesterone's main job is to support the endometrium. Okay, so let's go back to the follicular phase and work it through. Okay, that's kind of just bringing us all the way through, but let's talk more about the follicular phase. Okay, day 1, first day of the menses, period. We talked about what's happening with the ovary. We're maturing some follicles. We have one dominant, ovulation. The endometrium is starting to build up. So during the period, it sloughs off and becomes as thin as it possibly can at the end of the period. Well, ovulation is going to happen. We're looking for conception. It's got to start building back up. So it's getting a little bit bigger, a little bit bigger, a little bit thicker, all the way through the menstrual cycle. That starts all the way back here in the follicular phase. There's an effect on discharge. So the hormones are actually affecting the discharge. And when you go to the doctor and you say, you know, sometimes I have a thick, pasty discharge, or sometimes I have a really slippery discharge, it's like that's normal depending on where you are in the cycle. So in the first part of the cycle, way before ovulation, you either have no discharge, maybe a drier discharge, maybe pasty. As you hit ovulation, the goal is to have a discharge that moves those sperm up through the reproductive tract. It gets very thin and it's almost like egg white. And if you put it between your fingers, it will actually make like a long line of mucus, as opposed here in the earlier part where it's thick and pasty, you would not see any kind of long line of mucus. And that's actually a test that we do. It's called Benbarkite. Then after ovulation, we no longer need that help to get the sperm up. We want to block any pathogens from coming up into the reproductive tract. Then it gets thick or dry again. Okay, very, very normal. Okay. Just a fun aside, the other time that you get that thin discharge, slippery, is with sexual arousal. So sometimes people will have that thin mucus and go to the doctor thinking that that's abnormal, and that's just completely normal, either ovulation or sexual arousal, very normal. The temperature, in the first part of the cycle, the temperature is a little bit lower than after ovulation in the luteal phase. Progesterone in that corpus luteum increases the temperature a little bit by about a degree. So if you were to start tracking your temperature first thing in the morning before you get up, because it's like a micro change. It's not a huge change, it's a little tiny change, and they actually have thermometers that are very specific for between 96 and 99 degrees to see this. If you start tracking your temperature, you'll notice your temperature normal, normal, normal. At ovulation, once the progesterone starts going up, the temperature goes up, no longer fertile. So some people will track that for contraception. Okay, once the temperature rises, the person is no longer fertile. The problem is there are other things that can change your body temperature. So it's not a perfect way to try and track for contraception. There are apps that do that, and they're not that effective. We talked about the GI side effects and the headaches here in prostaglandins, not so much through the rest of the cycle. Okay. And then the breast tissue. Forgot to put breast tissue up here. Very sensitive to hormones. During the early phase, there are almost no hormones available. The breast is in its resting state. You go through estrogen. The breast tissue becomes responds to the estrogen is a little more glandular. The glands increase. The progesterone actually affects breast tissue and gets more lumpy and bumpy, very normal, and then it goes back to the resting state. Okay, so that was a lot. Let's recap a little bit before we move on to the luteal phase. And I know we talked a little bit about the luteal phase already. It's hard not to just flow into it, but I want to make sure everybody's understanding all of this. And this is a little bit more detailed than you need, but I want you to hear it, and then I'll really summarize it at the end. Okay. So again, we've got the menstrual period here in the early part. Day 1 is the first day of the period. Then in the follicular phase, we're recruiting those follicles in the ovary. We're building up the estrogen. We're looking for that dominant follicle. Once there's enough estrogen, we're feeding back to that hypothalamus and anterior pituitary that we've talked about in other lectures, getting an LH surge. The LH surge is what causes ovulation Okay, that's the whole point of this, is ovulation. After ovulation comes the luteal phase. Okay, so we're going to start talking a little bit about that. Okay. So let's go back to our ovary for a second. We talked a little bit, and we're going to review a little bit here. We've got that dominant follicle. We had an ovulation. The egg is now going into the fallopian tube, into the rest of the tract. The corpus luteum is what is left of this little sac-like structure. It is secreting progesterone and estrogen, trying to keep the endometrium thickened and ripe with good blood in order to implant the fertilized egg if it comes through. And if it doesn't, there's no conception. This starts to die off. Okay? You can see you've got a lot of progesterone, a lot of estrogen, and it's all going down. That is because your corpus luteum said, no conception, we got to do it again. Okay? So, as these hormones die off and go down, once they get nice and low, the endometrium starts to shed, and that's where you get your menstrual flow. And it brings us all the way back down here to where we had the menses. Okay, so it's a cycle, it just keeps going through. Okay. We talked again about the prostaglandins. The prostaglandins' job is to contract the uterus and shed that endometrial lining so that it can prepare for the next cycle. Okay. You can even see the follicle stimulating hormone, if you go all the way back to our blue line. Look, it's already trying to do it again. It's already going up before you've even had your period. You're recruiting the next bunch of follicles. It just keeps going in a cycle. Okay. So that is a ton of information. To me, super interesting, hopefully super interesting to you. But reality is, let's boil it down to, what do I really want you to know? Okay. I want you to know that estrogen is the predominant female sex hormone, that it leads to secondary sex characteristics, that it's important throughout the life, and has effects on many different parts of the body. I want you to know that there are two phases of the menstrual cycle. The follicular phase, which is variable. It goes anywhere from 14 to 21 days. And the luteal phase, which is fixed and is 14 days. Okay, always. I want you to know that the main goal of this, like why do we even have a complicated system like this, is for ovulation. This is how we reproduce. If we didn't have this crazy cycle, none of us would be here. I would like you to know a little bit about recruiting follicles, releasing eggs, and their flow through the reproductive tract. I would like you to understand a little bit about the menstruation and how those prostaglandins affect not just the expulsion of the thickened endometrium, the menstrual blood, but how it affects the whole body. So you can understand how different people feel during the period. And I would also like you to know a little bit about progesterone and how that it's the main support of the endometrium waiting for conception, but it also has an effect on PMS and how people are feeling in that last part of the cycle. So in nuts and bolts, I think that is what I would like you to know.